Hi, I'm Rochelle Jackson. I'm your non-toxic lifestyle coach. I am coming to you from California, and there's a reason for that. Today we are talking about eliminating toxins from medical treatments. You might not realize, well, before we go there, um, it's been a long week. As you can tell, I'm a little tired. But if you're going to be joining live, I'll be surprised as it's usually an East Coast and much earlier. Um, but if you do join live, hashtag live your name and where you're posting in from. If you're joining on a replay, hashtag replay, and again, your name, where you're joining from, so that I can get in contact with you. So I am in California because um, I have 5 kids, but um, my twin girls, which are my third and fourth children, are disabled and chronically ill or have a genetic disorder. And we found out about this a little over a year ago, um, when, after 3 years of pushing my um, pediatrician, um, I had it. And I said, I don't care what you have to say. I want a referral to our children's hospital. My daughter's back is not right. And I had her bend over in front of the doctor, and the top of her shoulder blades were like this, and her waist was like this. And we did get that referral. And we went to the doctor. We got a very quick referral. They did x-rays, and we were stunned. Um, she had curvature of the bottom of her S curve was about 46%. Now, granted, at the time she was 8, and the top was um, somewhere between 35 and 40. This is not normal for a child that small. Now, her twin sister is nearly a foot and a half taller than her, which happens, but was odd. And we were finally getting somewhere. So we went to see the orthopedic, and I will leave names out of this, but the doctor came into the room with us, and it was just me at the time. And I was told that the solution was that they would put her in a Boston brace, which is a rigid brace, and she would wear it 24 hours a day, 7 days a week, for a period of anywhere between 8 and 12 years. And she would have very little quality of life. And then once it was removed and we knew she was done growing, they would have surgery to put rods in her back. I at that time was shocked and took that doctor's advice and went and had her fitted for the Boston brace. And then we had an MRI, and the MRI showed a cyst in her kidney and several different things. I was devastated. And you can imagine, didn't know what to do. The grace of God happened, and we had a babysitter at our house that we don't normally have. And she had mentioned that she had scoliosis and that she had it fixed without rods. And here I was told that that was not possible by one of the top orthopedic doctors at Nationwide Children's. And I was confused. The next day, I received a phone call from this young lady's mother explaining that there was a specialist actually 3 specialists in California that designed a specialty brace that actually moved the spine along with a therapy that's a combination of a breathing therapy, a Pilates type therapy, and a physical therapy that we do every day. We go to therapy once a week, but then we do the therapy every day. And I had my answer. I immediately called and canceled the Boston brace. We were to receive it the very next day. And I said, we don't want it. We found another solution. So I called the Align Clinic with our orthotist, Grant Wood, who is the founder of the brace. And they happened to have a cancellation in 2 weeks. So Evie and I got on a plane, and 2 weeks from the point where we had a babysitter tell us that there was another solution, we were in California getting a revolutionary brace that didn't require medication, that didn't require surgery, that didn't require anything. Yes, it is a rigid brace, but it's a removable rigid brace, and it's much more comfortable. So we met with the doctor again this week, and we saw our x-rays from 1 year of her wearing it. And I can tell you that a child that had nearly a collective 80% curvature of the spine, and we were told would probably not even be able to have a straight spine with rods, is nearly halfway to a straight spine. 1 year. No medicine. Just a revolutionary brace because someone is out there thinking about medicine in a new way. The brace is called the WRC brace. Some people call it the or the RC brace. But I am amazed. In that year, her twin sister was diagnosed with scoliosis as well. Her curvature is different. She has a C curve, and she had about a 20%. So she's here with us too. She immediately started therapy along with Evie, and Bryn is extremely athletic and agile. And the therapy without drugs is a very specialized therapy. There are only 2 therapists in about 120-mile range that do this therapy. It's a squash therapy, and like I said, it's a combination of breathing therapy, Pilates, and we do 1 day of therapy with the therapist. He teaches us how to do it, and then we do it at home. We found out in the office with Dr. Wood that her x-rays looked straight as an arrow. This, the meter that they used to measure her scoliosis was under 5. Under 5. She does not have to wear a brace. And here she was in the same situation, being told that she would have to wear a rigid brace and have bars. Now her situation is unique. She has a twist in the base of her back that we'll have to work mostly through therapy on. But we are so blessed. So blessed. And I can't even tell you what a difference the Align Clinic has made in our life. Yes, it's expensive to fly to California for a week and stay in California for a week and rent a car. But it's also bonding with your child. And in this case, my twin girls have bonded in a way that I've never seen. I want to shake that original doctor and say, get out of your own head and learn something. But what I can say is there are diseases that require toxic treatments, but it's not the majority of them. Cancer treatments are toxic. You are basically killing your cells in your body to get better. That is something that is being researched and will eventually change. I know the BRCA gene is out there, and that has changed it for women with breast cancer, where they can have a mastectomy. And eliminate the risk of having breast cancer. But the basics of cancer do require toxins to be put in your body. But that's not the majority. Medicine has changed at a record pace over the years. However, our doctors that are not new out of med school are not required to keep up with these new and innovative ways of thinking. They are taught that if it looks like a horse and it sounds like a horse, treat it like a horse. Well, I'm here to tell you I'm a living example of that is absolutely wrong. I have common variable immune deficiency, and for over 20 years, I saw the same doctor. And every 2 to 3 weeks, I was in the doctor's office getting antibiotics for legitimate illnesses, burst eardrums, and I was just getting pills. There was no research done, no blood work done. I was given a sulfa drug and had a severe allergic reaction. And the way it was handled was that doctor decided that the appropriate course of action was to pink slip me, which meant a 72-hour mandatory psychiatric hold. But he lied to me. He told me to drive myself to, if you're from Columbus, to Riverside Hospital to see a dermatologist. I walked in the door and I instantly knew something was wrong. And I called my husband. I was surrounded by police officers. There was no valet available. And when I sat at the reception desk, which was suddenly available, they had all of my information at hand. And I said, wow, my doctor must have called you. And she said, no, we haven't heard from your doctor. I said, then how do you know all of this? They whisked me back immediately in an emergency room that had almost 50 people in it. And they put me in a room with a male nurse and an additional male nurse sitting outside. And it hit me at that point that something was very wrong. And then as the first male nurse was leaving, he said to me, it's okay, we've seen this thousands of times. There's no worms coming out of your skin. And I said, wait a second. I never said there were worms coming out of my skin. Where did you hear that? They already had me in psychiatric uniform, and I was not going to be released. I was not visited by the emergency room doctor, even though my scalp had literally split open right here. And I was having an allergic reaction called scalded skin syndrome or St. Jorgensen syndrome. My blisters were forming, my skin was splitting all over, and I was now being evaluated. I had seen this doctor for over 20 years. And he prescribed the medication. Had never given it to me before, and he missed it. He gave me a toxic medication in my body that damn near killed me. And had they not forced me to take Benadryl, I would have died. I was handcuffed, ankle cuffed, and head strapped to a bed after being forced to take a urinalysis with the door open. And the psychiatrist came in the room and told me that she felt something was wrong. And her reason for that was because she said people that are pink-slipped don't drive themselves to the hospital. They're brought in by ambulance or by Netcare. So my husband ended up talking to her for 2 hours, and I didn't know that. They put my left ankle cuff on too tight, and I almost lost my foot. And I have a very different view of how mental patients are treated, because in my simple ask to have them come in and look at my ankle because I could no longer feel my foot, they ignored me. They told me to shut up. They told me I wasn't right in the head. I literally took every medication that I was on into the hospital with me because I needed to get to the bottom of why I was so sick. Well, the psychiatrist came in and talked to me, and confirmed my story with my husband. They did do a CT scan for good measure. What that showed was that I had a very solid history of migraines, and that I had a lot of scar tissue on my brain because of the severity of my migraines. But that there was no underlying psychiatric activity happening. In addition, I was seeing a psychiatrist, a psychologist, and a doctor at that time because I had just recovered from postpartum psychosis and I wanted to stay on track. To my knowledge, to this date, I'm the only person that's been released from a mandatory pink slip hold of 72 hours at the 5-hour marker. The next day I called my doctor, told him he nearly killed me with the medication he gave me, that I wanted a copy of all of my records, and that I was leaving his practice. They were shocked that I called. They couldn't believe it. I saw a dermatologist within 2 weeks who referred me to an immunologist, and one blood test later, I found out I had CVID, which is common variable immune deficiency, also known as the boy in the bubble disease. I have very low production of 3 categories of antibodies and it's so low that I am so susceptible to getting sick that I subcutaneously infuse donor plasma every Friday. Um, and I thank God for you who give it. Um, and it reduces my illnesses. I still fight terrible illnesses. I get um, staph infection regularly. I get MRSA regularly. Um, I get eye infections, ear infections. Um, I'm allergic to everything. But that dermatologist and that immunologist knew that I was not self-harming myself and that the sores on my skin were impossible for me to touch myself or scratch myself open. So there are some really amazing doctors and practitioners out there that are using non-toxic and non-invasive methods to treat people. Um, we can't even say enough about living a non-toxic lifestyle, using essential oils, removing toxins from day to day. When I stay in a hotel room, I'm extraordinarily careful about bringing my own products so that I don't have phthalates or fragrances or parabens or am exposed to those types of things. But what I can say is that the good doctors are really good, really good. And they're not always, they can be chiropractors, they can be acupuncturists, they can be holistic doctors, practitioners of those sorts. And I encourage you to expand your thinking. They can just be people like me who coach on how to live a non-toxic lifestyle because it's reduced my children's ADHD immensely and it's made my health incredibly better. I used to have 3 to 4 infections a month. I maybe get 1 infection every 2 months now. It's remarkable. So not all treatments of diseases and disorders require pills, surgeries, or permanent implants. Sometimes they just require a removal of something. I found out I was allergic to corn. I was coughing and went to an ENT. I was literally coughing so bad that I could not stop. I was waking at night and they did a simple scope of my throat and they found out that I had silent acid reflux and it was causing me to cough. I had no issues with my acid, but because that doctor didn't just focus on the cough and the symptoms, but looked deeper, I'm able to treat my acid reflux with something called alkaline, which is a natural uh, supplement, and I don't cough anymore, except with pollen. But I even treat pollen with lemon, lavender, and peppermint essential oil. So I encourage you to do your own research. Don't be afraid to ask your doctor tough questions. The professional level of expertise that they have doesn't mean that you're not intelligent. It doesn't mean that you don't have the most information possible. Do your research, get former patients' information, and get referrals. Find a new doctor, even if it's across the country. Sometimes it's worth it. Sometimes they're in your backyard. The dermatologist that saved my life is at the end of my street, 4 blocks away. That is insane. But do your homework, because they're not always great. And if you walk in and your gut feeling is not great, walk out. The other thing is, don't assume that because it's out of state or because it's not through your medical insurance that it's going to cost you a bunch of money. There are amazing state and federal resources that can assist you financially and in research. We thought we would have to pay $5,300 for our daughter's brace, along with all the travel. We didn't pay a penny. Our insurance paid all but $2,000. And then she was deemed disabled. And we received the money we paid back from the Align Clinic. So in addition, our twin girls have Ehlers-Danlos syndrome and are being studied by genetics. We had to have a chromosomal test done that cost over $4,000 per girl. Our geneticist filled out one piece of paper, deemed them both disabled, and the test was paid for. There are grants because the girls are twins and they both have the same issues. It's an anomaly, and they're now research study participants at Children's for Ehlers-Danlos syndrome, and they're basically taking care of all of our bills. So don't be afraid to ask for that. Call the administration office and ask for assistance. They will always reduce your bill, always, by 25% minimum. The long and the short of this is, of the things that we have in our life, ADHD, OCD, panic disorder, scoliosis, Ehlers-Danlos syndrome. We aren't using medications to manage them. We're not pumping toxins into our children's lives. And we are so much better for it. We've removed toxins from our home over the last 10 years and had remarkable results. We don't go to the doctor except for once a year for our physicals. And that's pretty remarkable. So, what I want to share with you is that this is just the tip of the iceberg for us. We have an insane medical history. And because we've become advocates for ourselves and we're living a lifestyle that's non-toxic, we have never been better. So I encourage you to reach out to me, either by sending me a message privately or through the comments, or just visiting my website at www.nontoxiclifestyle.com and booking a free consultation just to talk about how to make it easier for you. We had a long road. If we didn't have that babysitter stay with us that one night, I'd hate to think where we are. But my 10-year-old daughters who have scoliosis are horseback riding, are swimming, are doing gymnastics. My most disabled ADHD son is teaching flex classes in information technology to the entire middle school. Last year as a 6th grader, and this year as a 7th grader. The kid used to lick the door in my friend's hands. Advocate for yourself. There are alternatives other than the toxic medications out there. And not all medications are toxic. I have to take a slew of medications to stay alive. But do your research and find the right ones. I know this was a long message, but an important one. So with all the love and gratitude I have, thank you for listening. And I hope this helps just one person out there find the right care and support from the right medical professional in this world. Good night and take care.